Hello, my name is Jeffrey Labig, and I am pursuing a career as a nurse practitioner. I'll begin by giving a brief, broad description of a nurse practitioner. Nurse practitioners work autonomously and in collaboration with other healthcare professionals to examine, diagnose, and treat patients of all ages. Because nurse practitioners have a broad nature of practice, they typically perform as primary care providers. In comparison to a primary care physician, nurse practitioners provide lifelong, comprehensive care through disease management, health education, and preventative health services. Retrieved from a study previously done at Columbia University, nurse practitioners reported working in a team effort and having a strong collaborative relationship with physicians, which includes sharing and exchanging responsibilities between them in order to provide the best care possible and meet their patients' needs. Nurse practitioners also reported working good together with registered nurses and other staff members to provide care to their patients. Nurse practitioners reported having a relationship on the lesser positive side with healthcare administrators, who are said to be away from the day-to-day operation and not as interactive in the nurse practitioner's scope of practice. Nurse practitioners' daily duties can vary depending on where they work and what they specialize in. However, nurse practitioners are qualified but not limited to perform the following tasks: manage chronic conditions like hypertension and diabetes, oversee the health and wellness of pregnant women, including providing preconception and prenatal care, provide health and wellness care to infants and children, treat minor acute injuries, provide episodic care for acute illnesses in all age groups, examine patients and establish medical diagnosis by client history, physical exam, and other criteria, admit patients to and discharge them from healthcare facilities, order, perform, and interpret lab, radiographic, and other diagnostic tests, identify, develop, implement, and evaluate a plan of care. Nurse practitioners can work in a variety of different settings depending on what their specialty is, but normally you can find nurse practitioners working at conventional doctor's offices, major hospitals, community clinics, private homes, schools, state and local health departments, and other ambulatory care facilities. The first step to becoming a nurse practitioner is obtaining a Bachelor's of Science in Nursing and a valid registered nurse license. Some schools require nursing experience or the GRE before applying for the nurse practitioner program. The rigorous program can last anywhere from 2 to 3 years and can have 500 to 700 clinical hours, depending on whether you are pursuing a Master's of Science in Nursing or a Doctor of Nursing practice. Every state is different, but typically, after completing the program, students must take a state board certification exam prior to receiving their license to practice as a nurse practitioner. The American Academy of Nurse Practitioners National Certification Board is a professional organization that provides nurse practitioners with a credible and reliable program to know their education, knowledge, and professional expertise, and to provide a process for validation of advanced registered practicing nurses' qualification and knowledge for practice as a nurse practitioner. According to the American Academy of Nurse Practitioners National Certification Board, every 5-year certification period, nurse practitioners who need to renew their license must obtain 1,000 hours of clinical practice as a nurse practitioner, 100 contact hours of continuing education, and hold a current registered nurse licensure during the period of certification. My 5-year timeline will begin on August 2019. I will apply and expectantly get accepted into the accelerated nursing program at USF. December 2020, upon completing my Bachelor of Science in Nursing, I will apply for a position at Tampa General Hospital as a registered nurse. August 2021, after taking the GRE and applying to the nurse practitioner program at USF, I will pursue my Master's of Science in Nursing. April 2023, after finishing the nurse practitioner program and passing the boards of certification, I will apply for another position at Tampa General Hospital as a nurse practitioner. April 2028, after working for 5 years as a nurse practitioner, I will need to recertify with the American Academy of Nurse Practitioners. This is a list of my references. And again, my name is Jeffrey Ladwig, and thank you so much for your time and listening to my profession presentation on nurse practitioner.